Nursing and Patient Care. Module 2. Advanced Principles of Patient Hygiene. Upon successful completion of this module, students will be able to determine the purposes for giving a patient a bath, identify conditions which encourage the breakdown of skin, identify interventions which can prevent skin breakdown, identify patient needs and observations which should be made during bathing procedures, identify the principles and reasons for the back massage, describe the guidelines for shaving a male patient, determine guidelines for performing perineal care, identify the principles and purposes of hair care, the purposes of giving the patient a bath. Providing for a patient's hygiene is one of the most basic of all nursing care activities, but it is undoubtedly one of the most important. Not only is it a provision for the patient's physical needs, it also contributes immeasurably to the patient's feelings of emotional well-being. Daily bathing. A daily bath is an essential part of patient care. It allows for the removal of bacteria from the skin, relax the patients, stimulate blood circulation to the skin, respirations and elimination, maintain joint mobility, improvement of the patient's self-image and emotional and mental well-being, provides the nurse with an opportunity for health teaching and assessment. Building rapport with the patient may begin during the initial bath, provides the nurse with an opportunity to give the patient psychological support. The development of the therapeutic nurse-patient relationship as the patient has the nurse's undivided attention. Bacteria builds up on the skin due to 1. Confinement in bed increasing perspiration and bacterial growth being stimulated by moisture. 2. Skin irritation from hospital bed linens may result in skin breakdown and subsequent infections. Skin breakdown. Physical conditions which encourage skin breakdown in a patient confined to the bed include obesity. An obese patient may have many skin folds where perspiration and bacteria can contribute to skin breakdown. Age-related skin changes. An older person's skin is very thin and inelastic, and the sweat and oil glands are less active. Thin, dry skin is more susceptible to pressure areas and skin breakdown. Any disease or condition that affects circulation. Any disease or condition that affects circulation can encourage skin breakdown in a patient who is confined to bed. Immobility. Continuous pressure over any body part impairs circulation to that part and can cause breakdown and eventual ulcerations. Incontinence. If the patient is unable to control the bladder or bowel function, skin breakdown is likely to occur due to the presence of moisture and bacteria on the skin. Emaciation. An emaciated patient may be prone to skin breakdown over bony prominence, heels, elbows, and coccyx. Preventing skin breakdown through nurse intervention. The time of the patient's bath or back massage is the most logical time to thoroughly observe the patient's skin for pressure areas. At the first sign of redness, the area should be washed with soap and water and rubbed with lotion. Measures should then be taken to keep the patient off the reddened area. Ensure adequate nutrition and fluid intake, according to physician's orders. Report any signs of pressure to the charge nurse. Keep sheets under the patient clean, smooth, and tight to help eliminate skin irritation. Every effort should be made to keep urine and feces off the patient's skin, washing the skin with soap and water and keeping the buttocks and genital area dry. Lotion or powder may be used depending upon the patient's skin type and when the patient is incontinent. Lotions and oils may be used after the bath. Obese patients may need assistance washing and drying areas under skin folds, groin, buttocks, under breasts, and so forth. For the patient with very dry skin, various bath oils may be added to the bath water. Soap may be omitted because of its drying effect. Timing of patient hygiene care. During adult patient hygiene care, a patient's bath may be given at any time according to the patient's needs. However, certain routines are generally followed on a ward during the morning and evening to ensure daily patient care and hygiene is provided. Morning routine. The procedure followed in the morning affects the patient's comfort throughout the day. Every morning the following tasks should be completed before breakfast. 1. Each morning before breakfast, the patient should be assisted to the bathroom, or a bedpan or urinal should be provided according to the patient's activity level. 2. The patient should be given the opportunity to wash their hands and face and brush their teeth. 3. The bed linen should be straightened, and the over-bed table cleaned in preparation for the breakfast tray. After breakfast, the patient should have a complete bath. Type is dependent upon the patient's condition and mobility, and should include mouth care, a change of clothing, and a back massage. Additionally, bed linens should be changed, and the unit cleaned and straightened to provide a comfortable and safe environment for the patient. Evening routine. The care the patient receives at the end of the day greatly influences the patient's level of relaxation and ability to sleep. Every evening the following tasks should be completed. 1. An opportunity is provided for elimination. The patient's hands and face are washed, the teeth are brushed, and a back rub is given. 2. Bed linens should be straightened, and the patient's unit straightened to ensure comfort and safety. 3. It is important that there are no items which the patient could slip on or fall over, such as chairs or linens on the floor. Providing for patient needs while bathing. During hygiene procedures, the nursing professional will need to provide for select patient needs such as safety, privacy, and comfort. Safety. 1. The bed may be in the high position during the patient's bed bath, but should be placed in the low position upon completion. 2. The side rails should be put up after the patient's bath for the patient who is confined to the bed. Side rails help to prevent falls in elderly patient and patients who are confused or have a decreased level of consciousness. 3. The legal aspect requires diligence on the part of nursing personnel. 4. The patient's call light should be within easy reach to prevent the risk of a fall while reaching for it, and to provide easy access in case of pain or distress. 5. Fire safety in the patient care area calls for no smoking in bed, and no smoking if oxygen is in use. 6. Always wash your hands before entering and upon leaving the patient's room. Privacy. Respect for the patient's privacy decreases the patient's emotional discomfort during personal care. In order to ensure the patient's privacy, you should 1. Keep the door to the patient's room closed. 2. Pull the curtains around the unit and drape the patient's body during care. 3. Allow the patient to complete as much personal care as possible, if self-care is appropriate and provides additional privacy. Comfort. 1. Ensure a comfortable temperature in the patient's room. 2. Close any windows and the door to the patient's room to prevent drafts and chilling. 3. Drape the patient appropriately during the bath. 4. For a bedside bath, maintain bath water temperature between 110 degrees Fahrenheit and 115 degrees Fahrenheit. Significant nursing observations during bathing. During bathing is an ideal time for the nurse to assess the patient's psychical and psychological well-being. Physical observations. 1. Observe the skin under good, natural light. 2. Any abnormal skin condition should be described by its location, color, size, and how it feels to the patient. 3. Color. Reddened areas indicate pressure, cyanosis, bluish tinge, or jaundice, yellowish tinge. 4. Temperature. Hot skin could mean fever, while cold skin could mean poor circulation. 5. Sensitivity, pain, tenderness, itching, or burning should all be noted. 6. Swelling, edema, stretched or tight appearance. Usually begins in the ankles or legs, or any other dependent part, and may be associated with injury. 7. Skin lesions, rashes, growths, or breaks in the skin should be noted. 8. Observations may begin at the head, scalp, and proceed to the feet in a systematic manner. Psychological observations. 1. Problems in this area may be related to the patient's medical problems. 2. The time of the patient's bath may be a good time to find out more about the patient's psychosocial needs. 3. Remember that the patient's nonverbal communication may tell you much about the way he/she is feeling. Mouth care. There are several important guidelines when addressing the mouth care of a patient in order to fulfill a variety of purposes. There are also several conditions which nurses should observe for. Guidelines. The important guidelines in oral hygiene for the adult patient are as follows. 1. Oral hygiene should be performed before breakfast, after each meal, and at bedtime. 2. Oral hygiene is especially important for patients receiving oxygen therapy, patients who have nasogastric tubes, and patients who are NPO. Their oral mucosa dries out much faster than normal due to their mouth breathing. 3. You should allow for patient privacy during the procedure, as this is an extremely personal procedure for most patients. 4. Oral care for the unconscious patient should be performed at least every 4 hours. 5. Lipstick, chapstick, or Vaseline may be applied to the lips to keep them from drying out. Purposes. There are several purposes of good mouth care in adult patients, including 1. Provide oral care of the teeth, gums, and mouth. 2. Remove offensive odors and food debris. 3. Promote patient comfort and a feeling of well-being. 4. Preserve the integrity and hydration of the oral mucosa and lips. 5. Alleviate pain and discomfort. Observations. Nursing observations for the patient's mouth should be recorded in the clinical record, noting such factors as 1. Bleeding. 2. Swelling of gums. 3. Unusual mouth odor. 4. Effective brushing the teeth. 5. Note if there is bleeding when you brush the patient's gums and teeth. Considerations for patients with dentures. Many patients are sensitive or embarrassed about wearing dentures. Therefore, the patient's privacy should be respected when the dentures are cleaned. Dentures must be handled carefully. They are fragile and expensive, and the patient is handicapped without them. If the dentures are left out of the mouth for any period of time, place them in a covered opaque container with the patient's name on the container. Dentures must be kept in water to preserve their fit and general quality. The color may change if they become dry. You may avoid breaking the dentures while cleaning them by holding them over a basin of water with a washcloth folded in the bottom. Dentures are brushed in the same way as natural teeth. Also be sure to rinse them well. The denture cup should be labeled with the patient's name and room number. Never use hot water to rinse the dentures as it could warp them. Use cool or lukewarm water. The patient's gums and soft tissues should be cared for at least twice per day while the dentures are out of the mouth. A soft bristled toothbrush, swab, or gauze-covered tongue blade dipped in mouthwash should be used to cleanse the gums, tongue, and soft tissues. Mouth care in chemotherapy and radiation patients. Bleeding, infection, and ulcerations, including stomatitis, are common in patients receiving chemotherapy and radiation therapy. Bleeding. Bleeding is common in patients receiving chemotherapy and radiation therapy. To aid it. 1. Check the patient's mouth frequently for the amount of bleeding present and note the specific areas. 2. Do not floss the patient's teeth. Use a water pick. 3. Brush the teeth and clean the mouth using one of the following methods. Brush the teeth carefully with a very soft toothbrush. Wrap a tongue blade with a gauze sponge saturated with a prescribed solution. Carefully swab the teeth and mouth. 4. Do not use lemon/glycerin swabs or commercial mouthwash because they contain alcohol, which causes burning. Infection. Infection is common in patients receiving chemotherapy and radiation therapy. To aid it. 1. Check the patient's mouth for appearance, integrity, and general condition. 2. Wear clean gloves during the procedure. 3. Obtain a culture if ordered. 4. Do not floss the teeth if the mouth is irritated or painful. 5. Assist the patient with brushing the teeth and cleaning the mouth, using a soft toothbrush or a gauze-padded tongue blade. 6. Rinse the mouth with water and the prescribed solution if ordered. Ulcerations. Ulcerations, including stomatitis, is common in patients receiving chemotherapy and radiation therapy. To aid it. 1. Basic procedure for the patient with an infection should be followed. 2. If the patient's mouth is extremely painful, rinsing the mouth with a local anesthetic, as prescribed by a physician, may be necessary. 3. Mouthwash and other solutions which contain alcohol should not be used for the patient with ulcerations, as they are frequently very painful. The benefits of a back massage. The benefits and guidelines of administering a back massage are: benefits. The overall benefits of back massage in patient care and comfort are: 1. Decreases muscle tension. 2. Promotes relaxation. 3. Increases circulation to the area. 4. Aids in the development of the therapeutic nurse-patient relationship. 5. The psychological benefits of back massage cannot be overstressed for the hospitalized patient. Guidelines. General guidelines for administering a back massage are: 1. A back massage should take about 5 to 10 minutes and can be given with the patient's bath, before bedtime, or at any other time during the day. 2. Determine if any patient allergies or skin sensitivities exist before applying lotion to the patient's skin. 3. The greatest relaxation effect of a massage occurs when the rhythm of the massage is coordinated with the patient's breathing. Therapeutic touch. The following points illustrate the concept of therapeutic touch as an integral part of the domain of nursing. Touch can be perceived as a manifestation of caring and communication between the nurse and the patient. Tactile communication between healthy and ill individuals can have highly beneficial results. Therapeutic touch may make some patients uncomfortable. You are entering their personal space and their feelings must be respected, so make sure you ask the patient if she would like a back rub. Lotions/emollients. Lotions and emollients reduce friction and lubricate the skin. They are appropriate for most patients, especially those with a tendency toward dry skin, that is, elderly patients. Powder. Powder reduces friction, but also has a drying effect on the skin. It may be appropriate for those patients who perspire freely and/or are confined to bed. Rubbing alcohol. Alcohol evaporates quickly, so it has a cooling but very drying effect. A certain amount of alcohol is absorbed by the skin, so it should not be used on infants, elderly patients, or patients with liver disease. Personal care for the adult patient. Nothing feels like a loss of independence as much as the inability to perform personal hygiene unassisted. The nurse's thoughtfulness and the professionalism you exhibit when assisting a patient with hygiene needs will foster the patient's feelings of independence, confidence, trust, and comfort. Shaving a male patient. If the patient is alert, you should question him about his shaving habits and follow his routine as closely as possible. The equipment and supplies you will need for shaving a male patient include towels, washcloths, a basin of hot water, shaving cream, a razor, soap, and aftershave lotion. Guidelines for shaving the male patient are as follows. Wet the washcloth and wring out any excess moisture. Apply it to the patient's beard area to soften the beard. Apply shaving cream to the beard. Shave the beard on the cheeks and upper lip in the direction that the hair grows. Shave the beard on the neck against the direction of the hair growth. Wash off any remaining shaving cream. Use clean water to finish washing the patient's face. Perineal care. Perineal care is often referred to as pericare and consists of the external irrigation of the vulva and perineum following voiding and defecation and is part of the routine. Patients may be able to perform their own perineal care or may need partial or total assistance from the nurse. Embarrassment on the part of the patient and the nurse can be effectively dealt with by ensuring patient privacy during the procedure and not totally exposing the patient's genital area. Key points to note during patient perineal care are as follows. Ensure patient privacy. Wipe from front to back, vagina toward rectum, on female patients to avoid contaminating the vagina or urethral meatus. Do not use the same washcloth for any other portion of the patient's bath. Patient's hair care. Hair care for bed patients is as follows. The supine position is preferred for weaker patients. Patients with significant heart or lung disease will not tolerate being supine. They must be in a sitting position. Hair care should be given regularly during illness, just as it would be normally. The purposes of hair care for the adult patient is as follows. Hair care improves the morale of the patient. Hair care stimulates the circulation of the scalp. Shampooing removes bacteria, microorganisms, oils, and dirt that clings to the hair. The key points from this module are: good patient hygiene not only provides for a patient's physical needs, but also contributes to a patient's emotional well-being. A daily bath is an essential part of daily patient care. Bacteria builds up on the skin due to excess perspiration and skin irritation. Physical conditions which encourage skin breakdown in a patient confined to the bed include obesity, age-related skin changes, diseases or conditions which affect circulation, immobility, incontinence, and emaciation. The nurse should observe the patient's skin for signs of breakdown. A patient's bath may be given at any time, according to the patient's needs. However, certain routines are generally followed on a ward during the morning and evening to ensure daily patient care and hygiene is provided. The procedure followed in the morning affects the patient's comfort throughout the day. The care the patient receives at the end of the day greatly influences the patient's level of relaxation and ability to sleep. During hygiene procedures, the nursing professional will need to provide for select patient needs such as safety, privacy, and comfort. During bathing is an ideal time for the nurse to assess the patient's psychical and psychological well-being. There are several important guidelines when addressing the mouth care of a patient in order to fulfill a variety of purposes. There are also several conditions which nurses should observe for. Bleeding, infection, and ulcerations, including stomatitis, are common in patients receiving chemotherapy and radiation therapy. Each should be treated in an appropriate manner. There are many benefits of administering a back massage, including decrease in tension, relaxation, circulation, relationship development, and psychological benefits. Therapeutic touch is an integral part of the nursing domain. Lotions and emollients reduce friction and lubricate the skin. Powder reduces friction, but also has a drying effect on the skin. Alcohol evaporates quickly, so it has a cooling but very drying effect. The nurse's thoughtfulness and the professionalism exhibited when assisting a patient with hygiene needs will foster the patient's feelings of independence, confidence, trust, and comfort. When shaving male patient, if the patient is alert, the nurse should question him about his shaving habits and follow his routine as closely as possible. Perineal care is often referred to as pericare and consists of the external irrigation of the vulva and perineum following voiding and defecation and is part of the routine. Hair care should be given regularly during illness, just as it would be normally.